Hi everyone, I'm Dr. Shana Capra, board-certified pediatric dentist, founder and owner of the Kids Dental Practice in Delray Beach, Florida. On a personal note, my husband and I have 5 children, so as a dentist and mother, I have first-hand experience on the stages of dental development. With this presentation, I'm happy to be supporting Go Mommy Club and Baby to Baby, which provides children in poverty with basic necessities. Now let's talk prevention, and let's start at the very beginning, when you're pregnant. When you're close to welcoming your child into the world, you begin to look for a pediatrician. You're asking your friends for recommendations. You're looking for a doctor who aligns with your beliefs, whether it's a holistic approach or an allopathic one. At the end of the day, you make sure your child has a pediatrician because you're aware and you know how important it is. Some parents are not aware that equal importance should be given to establishing a relationship with a pediatric dentist by the time your child turns 1. Why a pediatric dentist? Why can't I just take my child to see my dentist? For the same reason you take your child to see a pediatrician and not your physician. Now, to help you understand the importance of prevention, let's look at this photo. This child is 2 years old, child A. This condition is called severe early childhood caries or baby bottle caries. It's very painful, and this condition is extremely common and it is preventable. If child A had been to a pediatric dentist by age 1, they would most likely not have these cavities or be in the early stages and look like this. At that point, the pediatric dentist would have had the opportunity to educate parents on prevention techniques and also bring up nutritional habits that contribute to the formation of cavities. If you've ever had dental pain, I'm sure you'd never want your child to experience that. On that note, a big concern for parents is the cost of dental visits. They fear that it will be expensive, so they don't visit regularly. That couldn't be farther from the truth. Prevention is a lot cheaper than neglecting and waiting for a tooth to hurt. When a tooth is hurting, the child will need extensive dental work, and obviously, it's a higher cost than a cleaning or a simple filling. Now let's talk about child B. Child B has been visiting the dentist since age 1, and parents have been following the dentist's recommendations. All of a sudden, in one of those checkups, the dentist finds small cavities growing between the teeth, which can only be seen on an x-ray, and that's why x-rays are important, but that's another topic. There are conservative treatments and options that we can use to prevent the cavity from growing and causing a serious infection. You may have heard of silver diamine fluoride. We use this on small cavities, and there's usually no drilling or dental anesthetic involved. It's a very simple technique, as you can see in this photo. It's also very inexpensive compared to the price of a filling or a crown. At the same time, child B's parents made recommended changes proposed by their pediatric dentist, and the child went on to lose all of their baby teeth with minimal dental restorations or treatment, and also welcomed the permanent teeth into a healthy oral environment. Why? Because they prevented it by visiting their dentist every 6 months. Now, let's go back to child A. These parents thought it wasn't necessary to treat those cavities because the teeth would fall out soon. Baby teeth don't fall out at the same time. Baby molars fall out closer to age 12, and serious dental infections can occur before that time. Like the abscess in this photo. It can even cause swelling of the face. Is this preventable? Yes. Here's a sequence of how cavities grow. The larger the cavity, the more invasive the treatment. So if your dentist tells you your child has a cavity, do something about it now. Because you wait, it'll get bigger and the treatment will be more invasive and more expensive. Cavities don't disappear. Here's the typical treatment sequence of an untreated cavity. First, it gets into the point of needing a filling. If that's not done, the cavity grows closer and into the nerve. You can no longer restore with fillings. Now you have to perform a nerve treatment and place a crown on that tooth. If the cavity has extended past the tooth structure and has infected other areas, it may need to be extracted. And because the child's losing this tooth prematurely, we need to save space for the permanent tooth, so we place a space maintainer. If we don't place a space maintainer, then the permanent tooth can get impacted and the teeth in that area may come in a different place like in this photo. The consequences don't stop here. Then the orthodontic treatment also becomes more complicated. So with that said, the take-home message is that regular dental visits and prevention are crucial to the well-being of your child. This is why it's important that you find a pediatric dentist that you trust and allow them to care for your child's oral health. Equip your child with healthy oral habits and instill in them the importance of regular dental visits throughout their adult life as well. Now, let's talk about some tips for prevention. Number 1, start brushing your child's teeth as soon as they come in with a smear layer of fluoride toothpaste twice a day. Limit juice intake to once a day and give them plenty of water throughout. If your child doesn't like water, it's usually because you're giving them juice as an option. Don't put your baby to sleep with a bottle. Remember, child A, the last thing in your baby's mouth before they go to sleep should be the toothbrush. If you must give them a bottle to soothe them, give them a bottle with water. Keep in mind that breastfeeding and formula feeding on demand in the middle of the night after you've introduced solid foods to your child puts them at a very high risk for cavities. This can happen not just with breast milk or formula. It can happen with juice or any foods that contain sugar. Start flossing their teeth as soon as they're touching. Flossing can be difficult to adopt as part of our daily routine because most of us weren't taught as children. However, our parents did bathe us every day, so it's easy for us to do that. Put a little effort into making flossing a part of your child's routine so that as adults it's just as important as bathing. Number 6, help your child brush their teeth. Allow them to brush first to encourage independence and follow up by brushing any areas that they missed. Don't expect them to brush perfectly at a young age or to remember to brush twice a day. They're kids and we need to repeat ourselves at least 5 times, right? So I hope that I provided valuable information, and if you have any questions, feel free to reach out through my Instagram at dr.capra. It was a pleasure sharing this platform with such a wonderful and informative team. Until next time.